to what we can provide here, the first slide is about when you're deciding what to measure. So we've reviewed your proposals and have looked at some of your proposed measures in that document. And over our conversations, we might hone in on some new measures or help revise the existing measures. So on those calls, we'll want to clarify the expected outcomes for the project, really determine the indicators of progress that align with those expected outcomes, and then deciding what types of data are needed and also realistic to capture, given both the capacity of the project team, the resources available to you, and also the data collection sources, so whether that's an EHR or different surveys that you may have.
One thing that we had talked with Vinu about was just making sure that the evaluation plan is really realistic. So we're going to want to make sure that while we may be suggesting things for you to measure and push you in some ways, that we also want to make sure that it's realistic. So that will be something that we'll be encouraging you to push back on us if you're thinking something is not realistic.
Okay, thanks. So the next area where we can provide support is helping determine the appropriate data collection methods and sources. So part of this may be helping you identify potential strengths or limitations to different methods or sources, discussing how you can use both quantitative and qualitative data to help tell the story of your project implementation and the story of how outcomes may be occurring. Also talking with you about the feasibility of using control groups or obtaining and documenting baseline data to really look at changes over time. We know that some of you are already planning on doing that and mentioned that in your proposals, and others we may want to ask if that is a possibility. And then also